Did you know that ankle injuries account for, or actually 11 million ankle injuries are reported yearly? Did you also know that if you've had an ankle injury, you're 5 times more likely to have another ankle injury within that year? And did you also know that most importantly, the therapies that we have available to us don't actually fix the problem, they simply manage the symptoms. Now, what if there was a way to actually change the movement of your ankle joint and to have an effect on your arch? Well, you don't have to imagine it. We've created it. And that's what the Posture Pro method is all about. Today, we're going to be talking about foot pronation and the impact that it has on the upper body, and ultimately the way that it could actually create injury, affect your quality of life, affect your gait, and create a myriad of other symptoms. So when we're looking at the foot, there are studies that talk about how having just 1 millimeter of height under your big toe can actually challenge your stability and modify your gait. Just to give you, put things in perspective for you, 1 millimeter is no thicker than this, right? So that's the thickness of a credit card or simply a business card. So in other words, if you have shoes that are too small to accommodate your foot, then this could potentially modify your gait. Keep in mind that the arch of the foot is not something that we are born with. We actually will develop the arch of our foot through movement in the first years of life. Now, the longitudinal arch, which makes up the landmarks between your big toe, the higher point of your ankle, and the lower point of your calcaneus, is supposed to form a kind of like a dome, a well-formed arch. Today we're talking about how the changes in that structure can actually affect your lower body, but can also have an effect on your upper body. So in other words, and this is what I'm going to do here. This is my left side and this is my right side. So if I internally rotate the tibia, just like this, you see what happens to my arch? Do you see that? It kind of collapses. So the thing is that if my arch is weak and if my midfoot is collapsed, it will have an effect on my tibia. So now for demonstration purposes, we have our friend Bucky here, and I've removed one of his legs to show you what actually happens to the upper body. So this is the same foot that we have over here. And if I actually internally rotate that tibia, you see the patella right here, the knee joint? Well, that's the internal rotation that goes right this way is going to create compression. And that compression, it's basically going to change the mechanics of your knee. Then, if this is true, if this reality is true, and if my tibia is internally rotated, my femur will actually follow through with it and will internally rotate all the way up to my greater trochanter, which is sitting in my acetabulum. So what ends up happening is that the mechanics of your foot will 100% affect the mechanics of your knee, which will in turn affect the mechanics of your hip. What is that going to create? Well, it's going to create a myriad of different symptoms because the internal rotation of that hip is going to have a direct impact on your iliac bone, and that's going to go all the way up to your cervical spine, but most importantly is going to affect the curvatures of your spine. So looking at the feet really is a great indication in regards to what's going on upstream. If you look at someone's sagittal plane, you can have a pretty good understanding or a pretty good perspective as to what's actually going on with their feet. But I wanted to talk to you today about different studies, and I'll be posting them in the description below, that talks about how we can actually address the arch of the foot. So most therapies that are available to us, I don't know if anybody that's watching has any ideas, how can we we address a flat foot? What is it that we can do? I think that you'll all agree with me that most of the exercises that are available are stretching exercises, strengthening exercises. They may even be proprioceptive exercises, and I speak about proprioceptive exercises in a lot of my posts. Now, it's not to say that these methods are wrong. They're not wrong, but they're just incomplete, because when we look at the foot, it actually has 3 different components. You see those bones here? Well, they're held together by muscles and joints. So there's 3 ways that your foot can actually affect your posture. Biomechanically is what we just saw right now on Bucky. An internal rotation, a flattening of the midfoot creates an internal rotation of the tibia, an internal rotation of the femur, and that basically has an effect on our pelvis. So that's on biomechanically, there's a problem there. But then there's going to be another problem. If our midfoot is collapsed, it's also going to create improper feedback to our brain, because there's 2 components in the foot that send sensory feedback to our brain: the skin of the foot and the muscles and the joints. So the information from the skin of the foot, we have in our skin very precise sensory receptors, and they function like little antennas, and their job is to basically send information to our nervous system and let our nervous system know exactly what's going on as far as where our body is in space. More specifically, it gives precise information in relation to gravity. So how are we doing in this gravitational field? This is what the nervous system wants to know, and that information is coming from the skin. However, if you have a flat foot or a pronated foot, then your muscles and your joints and your fascia is also going to be compromised. Well, the proprioceptive input from the muscles and the fascia is going to go through another part of your brain, which is going to be the cerebellum. And the cerebellum the job of the cerebellum is to regulate posture, muscle tone, involuntary muscle tone, but also to activate the intrinsic muscles of your spine. So in other words, there's 3 ways that this entire foot structure can actually decompensate posture. Remember that the cerebellum not only has an effect on the tonic muscles, but also has an effect on your inner ear and on your eye movements. So that's going to create a myriad of other symptoms, which we're not going to discuss in this live, but I'd love to discuss in another live if you guys have any questions. So what can we do now? What's available to us? Most of the treatments that are available rely on strengthening and stretching that foot muscle, and even in some cases creating some support on the arch. And all of those methods actually don't aim to change the motor engrams in your brain, or certainly don't aim to improve the actual proprioception of the muscles and from the joint. When you're doing those stretching exercises, you are having an effect in that moment. But if your foot is stuck in that posture, or if you've been functioning with a compensatory foot for more than a year, chances are that the treatment that you're receiving in that 1 hour is not going to be able to undo all of the wrong that you've been living with for at least a year, or in some cases much, much longer than that. So you have to find an equilibrium. You have to find a way to send sensory input to your brain 24/7, 7 days a week. And that's why we created our proprioceptive insole. I like to call them postural insoles. There's different models. I want to show them to you here very quickly, but they are based on different studies, and they do work on different specific components. The model that we've created for you is the foot activation insole, and this here has 3mm wedges. And basically these wedges, what their job is specifically is to stimulate your entire foot. Keep in mind that the entire foot, the heel, the midfoot, and the toes send very precise information to your brain. So when you put your foot on here, you're actually targeting the skin of the foot. That's going to be the same area in your brain that receives information from movement of your fingers and movement of your mouth. So that's really important information. So this is for general stimulation. It also works beautifully with primitive reflexes. And I want to mention that all of the insoles that we work with actually have an effect even when you're sitting down. So not just weight bearing, when you're actually sitting down, and you can do different tests to quantify this. We've tested it on force plate platforms, and we can talk about that again. If you want more information, feel free to send us a message. The next model I want to talk about is the upper the upper back model. Now, studies have shown that when you use very, very thin wedges in different parts of the foot, you can actually have an effect on the spinal cord. So this model here will specifically target, through wedge technology, will specifically target the upper back. So if you find yourself having rounded shoulders or having somewhat of a posterior, a posterior scapular plane, or even a forward head posture, that is the model that you're going to want to have. So we've created this model because we want to make it affordable for absolutely anyone. Now let's say you want to target your glutes. You have issues with your lower back, you have an anterior pelvic tilt, you have an a forward projection of your upper body. And how would you know this? Well, if you look at yourself from the side, see, this is a fairly neutral posture. The head is fairly aligned in relation to the shoulders and to the pelvis. But if you actually move forward, then that would be considered an anterior scapular plane. That's a forward projection of your center of gravity. Well, guess what? You may not know this, but your brain knows this, and the way that your heart is going to be pumping is going to be affected by this reality. So in other words, your blood flow and your heart rate is affected. But most importantly, in this example, your posture will be affected. So for every inch that your spine moves forward, you're adding pressure on your lower back. So what are we doing here? What insoles can you possibly pick for this? Well, we've created the model which is called the lower back. And you see those wedges here again through wedge technology. This is based on science. What we can actually do with this is when you put this under your foot, just like this, your brain will feel that you're actually being pushed forward. So guess what that is going to do? If you feel you're falling forward, what will your body do? What will your nervous system do? It's going to pull you back. So through a very, love you too, Zardison, thank you so much for your comment. So through wedge technology, you can actually modulate and change your center of gravity without even thinking about it. So imagine that on a 24-hour basis, 7 days a week. Now, I want to mention that those postural insoles is not something that you have to wear like orthotics for the rest of your life. They're really made to help you to change those motor engrams in the brain. And this brings me to my last model, which is our most popular model. It might be a little bit more costly, but it is an investment. And I do encourage you to look into different studies that talk about the role of proprioception as far as the center of gravity and, ankle movement, knee movement, posture, and all of that. But those therapeutic insoles here, we use a special type of frequency. This is a newer frequency based on, it's actually a newer model, which means that the frequency never really expires. It goes on for life. And why a frequency, you ask? Well, because those sensory receptors in the skin of your foot actually have an effect on they're located in the superficial part and then the deeper part of your skin, right? Your skin, we're just zooming up on the skin and we're looking at those sensory receptors. And some of these receptors actually respond to frequency. And this has been published. This has nothing to do with insoles. It just has to do with the way that the human body functions. So in that respect, those proprioceptive insoles, those therapeutic insoles will stimulate those sensory receptors specifically through a frequency. And this, I would suggest this model for anyone that has pain. So if you have pain anywhere in your body, it really doesn't matter where you have the pain, your ankle, your knee, your lower back, you've tried everything. Keep in mind that as long as your posture is misaligned, as long as the weight-bearing surfaces on your feet are misaligned, as long as your eyes are not tracking properly, I've done many videos about this, then as long as this is happening, you're going to have a misalignment of your body. Your center of gravity will be challenged and you're going to waste energy standing upright. So those are postural insoles. The different models that we've created are there to help you. We've tried to make them as affordable as possible for absolutely anyone. Read our reviews. Many people are giving really awesome testimonials as far as the results that they're getting. And Kano, you've been suffering with leaning forward for 5 years and you've tried so many things. So I would suggest looking at your feet, figuring out whether or not you have what I call a mixed foot. A mixed foot is when you actually stand up straight and you just lift one leg up and feel the first movement that your foot does. I'm pretty sure that you're actually in opposition, meaning one foot probably pronates and the other one supinates, and that creates torsion on the pelvis. But most importantly, it causes your center of gravity to move forward. However, if you are clenching your teeth, that will also push your center of gravity forward. Remember that the symptoms that we may experience, or that our friends or family may have, or even our clients or patients or athletes, the symptoms that you're seeing are multifactorial. Again, I'm going to exclude anything that is traumatic, but if they are multifactorial, it means that you have to work on all of those different sensory entries at once, simultaneously, to have an effect on posture. And if you're not doing that, that's okay. Just know that the effect that you are providing will only be temporary. So make sure that your clients or your patients know this, and most importantly, make sure that you give them a choice to choose the best treatment. So as a quick recap, the position of our foot, a flat foot is not something that we're born with. This is something that we develop through time. Our shoes can actually affect the formation of our arch, and I did some videos about what to look for in a shoe. If you have an internal flat foot or a collapsing of the midfoot, you will have an internal rotation of your tibia, you will have an internal rotation of your femur, and this will create a forward displacement of your center of mass. If you are clenching your teeth, if your eyes are not tracking properly, those are things that are going to be added on to the problem. We've created solutions to help shift your body weight back, or neutralize it, or even help with alignments of your shoulder buffer or your pelvis buffer. And those solutions are either with some of our most popular models of our therapeutic insoles. We either have a foot activation that works on sensory stimulation of the skin. We have lower back solution, which targets specifically the lower back and aims to address that pelvic tilt and forward displacement. We have rounded shoulders. This model specifically will work at targeting the upper back. And if you have pain, we have the therapeutic insoles. Yes, you should be the old models that you had previously. Just to answer the question about the insoles that you had 3 years ago, the older model that you have, the frequency would expire after a year to a year and a half. The frequency now is ongoing. It is never ending, and it will continue as long as you have the insoles under your foot. So you should order another pair, if anything. Because you don't actually lean forward, you just tell your brain that you are leaning forward. I'm not sure what you mean by that, but a lot of people that are actually leaning forward don't even realize it. What you have to keep in mind is that the spinal cord has specific landmarks that need to be respected in order to have physiological curves of the spine. And unfortunately, your foot has a direct relation with that. So in that sense, addressing the foot, this is not something that you're aware of, but certainly addressing the foot will help you work on this. So that's it for today, guys. Yes, just before ending, Adrienne, tips on the types of shoes. So I've done a video. If you guys go into my reels or into my IG channel or even YouTube channel at Posture Pro, you will find many tips on the shoes that you should be wearing. In a nutshell, the shoes must be made to accommodate the foot. And know this, all of the clients that I see think that they have the proper shoe size. They don't. Every single person that I see here has shoes that are too small for their feet. So this is extremely common. If you're walking with shoes that are squishing your toes on a daily basis, then it's going to eventually change the movement of your foot, and that's going to change the functioning of your lower body, and that's going to affect your posture. So I'm heading over to Facebook to do this same live. I really appreciated your questions, guys. Please, honestly, leave me comments if you'd like to know more information. Send me a message. Let me know if you have any specific cases that you'd like for me to address in our next live. And on that note, I'm wishing everyone a super Sunday.